I'm Sarah Henderson. I'm one of the consultant geriatricians here in Forth Valley, and I work in the Hospital at Home service. The Forth Valley Hospital at Home service has been running now for 4 years. It was born out of the COVID pandemic. It became clear as we were assessing people in their own home that actually frail older people could benefit from being managed within their own home. And following that, we were able to put in a business case to the board to support the development of an actual hospital at home service. It allows us now to treat up to 25 people who are frail in their own home, who present with an acute medical problem, delivering things like intravenous fluids, antibiotics, diuretics, in order that they can receive that secondary care level medical response in their own home to hopefully get better and then be discharged.
I'm Julie Binney. I'm an advanced nurse practitioner with the Hospital at Home team. Personally and professionally, it's a much more satisfying role. We like seeing how the patients get on. They much prefer to be in their own home and be looked after. The demographic of our patients, they're scared to come into hospital. It frightens them that they might not get back out if they come in. They're away from their family, they're in unfamiliar environments, they're away from their pets. They can mobilise around their own home better because they're in their own environment. They've got their own toileting facilities, they've got their own meal prep facilities, they've got their own televisions, and it's less noisier as well, so it's a much more calming environment. We get really unwell patients that we do manage to keep at home, and we do manage to get better through our treatments and our interventions. We have had several patients who you would have thought they need to be in hospital, however they didn't want to go in hospital, so they actually take a bit of a risk themselves with staying at home. I guess that's the main challenge, is making sure that they're safe at home, particularly if they don't have a care package. We get lots of great feedback. We get a lot of feedback on care opinion. They're always grateful for their input. One of our patients recently wrote to the Falkirk Herald discussing our service and how amazing, I guess, that our service was and how beneficial it was to both the patient and his wife.
My name is Terry Sylvester. I'm the clinical lead occupational therapist for Hospital at Home. In Hospital at Home, we're fortunate to have 5 allied health professions. So we have physio, we have occupational therapy, we have dietetics, we have speech and language, and we also have a pharmacist. One of the huge advantages of Hospital at Home is actually treating the patient within their own home environment. Hospitals are very important, but they do lend a bit of an artificial environment to patient care. The advantage we have in Hospital at Home across the allied health professions and with our nursing and medical colleagues is that the accuracy of what we do with somebody in their own home is really improved. Another advantage is actually that your patient is less likely to lose their care package through an admission and then a lengthy wait. So we're able to keep them at home, assess them at home, and then try and make sure that all our assessment is very patient-centred and very timely. We're seeing people at an acute stage. What we're able to do is not only just try and prevent this admission to the main door of the hospital, we're trying to prevent future admissions as well. So actually just seeing somebody with a more realistic environment around them means that we can try and put those interventions in at that stage and trying to future-proof a wee bit as well. So falls prevention comes into this a huge amount. It's for the same reason that having more access to step-up beds would also facilitate trying to prevent people getting to that main door of the hospital and be able to keep them at home for longer, or less likely to need to have that acute intervention in the hospital and have them returned home as quickly as possible. So it all fits in with the discharge planning side of things, but we're actually trying to prevent even getting to that stage. We're trying to prevent them even getting to the front door. We're very fortunate at the moment that we have some practitioners that are doing their advanced clinical examination course and trying to embed those skills as well, so that we increase the generic roles of the team, we increase their flexibility as practitioners, reduce the footfall into patients' houses where that's not necessary, and we're as patient-centred as possible. All of our allied health professionals can go out with their clinical observation kit bags. We're working on ECGs. We're then hoping to move on to taking BMs, doing bloods. Again, having that flexibility within the team of making sure that we also have the dynamic aspect, the responsive aspect that is appropriate for the bigger service provision. One of the huge assets that we've had to Hospital at Home of late has been a community link worker. This is somebody that has extensive knowledge of the communities within Forth Valley. That's a very changing picture, third sector-wise. We're all very aware of how quickly that can change, but she seems to have exhaustive knowledge of these resources. And sometimes it's really important, again, with the future-proofing and making sure people are able to self-manage their conditions better, to be able to have somebody that we can feed into to make sure that people, once they're out of the acute phase, are able to have that resource. And that, again, is a hugely person and patient-centred aspect of the team. It's very important that it's not just looking at the acute phase, which in itself is hugely important, but it's also trying to look ahead a wee bit and take the opportunities that come up so we can optimise the outcomes for the patient and their families. The feedback we get from patients is generally that they are thrilled that they've been able to stay at home. There's a huge relief that you can see occurring in patients and their families when they're able to stay at home. On the other end of things, if we do have to say to them, look, really sorry, we're going to have to go with hospital admission here, they seem more confident that we've exhausted all options that we can, perhaps short of the care element. The team's very good at having respect and DNA CPR conversations as well. And I think there's a real compassion that they bring to those cases where there's palliation. Those kind of conversations are generally better had at home rather than perhaps on a hospital ward, where there's an awful lot going on around you and maybe a curtain separating you. The conditions sometimes really don't lend themselves to that, whereas in the family home, you're more likely to be able to have that environment set up, and people then have that family support. They're able to come to them straight away and help them deal with those kind of aftermaths that you naturally get from difficult conversations. The feedback has been extremely positive, and you are very, very aware that you're in a privileged position being able to be on somebody else's turf. It is a partnership, then it's more of a partnership between you and the patient.
The future of the service is going to be an expansion with the investment of money from the Scottish Government. We're looking to increase the footprint of the frail older people beds, along with working with our colleagues in the respiratory team. We've already undertaken some pilot work to support 5 respiratory beds, and the hope is that we can increase that up to 10 for people with respiratory illness to be managed by the respiratory team in the community with our support. We're looking to work with the OPAT, so the outpatient antibiotic service, to deliver intravenous antibiotics to people in their own home, and also with the heart failure service, in order that we can try to support people with heart failure to be managed in the community.
I think in hospital at home we're all passionate about making sure that we use not only our own time effectively, but our patients and the supporting people's time effectively as well. And that's all part of the bigger picture of right place, right time for the right care.